Hey, welcome to another video from SkinnyMedic. This is a request I've gotten quite a bit here recently, is to do a video on how to demonstrate the proper use of a BVM, a bag valve mask. So, in this video, I'm going to show you how to use it, when to use it, and some things to look out for. So depending on which manufacturer you have your BVM, they may require different things. So, first thing we got to do is assemble it. And most of them assemble pretty close to the same thing, but I'll show you. We'll pull this out. Alright, so this is our mask. It's going to go around the patient's face. This is our reservoir. They come pushed together to kind of save space, so you want to pull them apart. Most of them generally do that part. We can connect our oxygen reservoir, connect our mask piece here, and then this is our oxygen tubing, which we will connect to the end here. And this will go to a tank. So you can see here I have the three main sizes of BVM. You have an adult, child, and infant. The main differences are going to be the size mask here to make sure that we can get a good seal on the patient's face, which I'll show you in just a few minutes, and the size of the actual reservoir here. So we wouldn't want to use an adult on a ped because you can overinflate their lungs, cause a pneumo, cause gastric extension, a whole lot of issues. But if you use this one, you're squeezing it just enough to get chest rise. This is good on an infant. Here you have a child, adolescent, you squeeze it just enough to get chest rise. And then an adult, they require more tidal volume, more capacity in their lungs, so that's why these are bigger. They make multiple size masks here. This is our child mask here. You can see compared to the adult size mask the difference. So if I was here, I cannot get a good seal. It's going to leak around the mouth, things like that. So choosing the appropriate size mask is important. Get a good seal across the nose here. Seals completely around the mouth. This is the size we need. So this one, hook around the nose, you can see I've got gaps over here in the mouth, and it's just not going to be appropriate. So you can still use this without oxygen, but if you have an oxygen source, then you can attach this tubing to it, and this reservoir will completely fill. So if you have the ability to connect your BVM to an oxygen cylinder, then you should do so. Then you're providing 100% oxygen to your patient. So 10 to 15 liters is about where you want to set it at. If I'm in the ambulance and I know I have a big full M tank, then I don't really worry about it as much, unless I have an extended long transport time. But if I'm inside the house, inside a residence, and I'm using the E-cylinder, small portable cylinder, then I'm a little more cautious about it. So you just want to make sure that you keep the reservoir inflated on the BVM. So this one does have a peak valve, so in theory, if I overinflate the lungs, it builds too much pressure up, it's going to get released out through this section here. This one also does have the ability to hook up to a vent, just kind of figure out which BVM manufacturer you're using. It also helps to use an airway adjunct, that way you lessen the chance of air going into the stomach and going into the lungs where it's supposed to. So without using airway adjunct, you have a little more chance to get air into the stomach, into the belly, which is going to cause vomit and things like that to come up in the airway. So using an airway adjunct does work. Now, I'm going to show you what they call an EC technique. So you have a C and then an E here. So C fits around the mask, and then the E connects to the jaw. And you want to pick the jaw up, pick the face up. You don't want to push down. You want to pull up. If you push down, you're going to likely to close the airway off. So if you pull up, get a good seal, and squeeze the bag just until you get chest rise. That's all you really need. So just to give you a little bit better idea of why we want to use an airway adjunct. Okay, so this is as we're looking at the patient. This is their tongue. This is their bottom jaw. So their whole upper jaw is missing. And this is where we're going to go into the lungs right here. The bottom hole there is where we're going to go into the stomach. So what happens is the tongue falls back, falls down, covering up this hole here. So air only has one place to go, into the stomach there. So when we use an airway adjunct, it pulls the tongue out of the way, letting us put air into the top hole. So on an adult, you'd want a bag about every 6 to 8 seconds. So I squeeze the bag, get chest rise, and then count to 6. So 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1000, 6 1000. A lot of mistakes that first responders make, nurses, physicians, respiratory therapists, is they bag too fast. So what you see is they typically squeeze about as fast as they're breathing. So if they're excited, they will breathe. And what they're doing is they are overinflating the lungs. So they overinflate the lungs, air builds up, goes down into the stomach, and you increase gastric contents and pneumonia chances and aspiration, all this stuff. So slow it down. If you have this connected to oxygen, you're squeezing 100% oxygen into the lungs. So you may have to modify your EC clamp depending on hand size, facial features, things like that. It may be complicated. So I've seen people when you come over here, here, however you need to adjust it to make sure you can get a good seal. That way no air is leaking out around the mask anywhere around. An easy way to do this too, if you have two people, is for the one rescuer to hold an EC clamp on both sides. That way you know you're getting a good seal. Pick the jaw up, pick the face up, pick the jaw portion, the face here, pick it up. One person holds the mask and the other person would squeeze this. So one person holds, other person squeezes. One of the things that can complicate this procedure is if someone has facial hair, they have a lot of beard here, then this may not get a good seal around here where the facial hair is. Another problem you're going to see is facial trauma. Someone has a lot of facial trauma here, you may not be able to get a good seal. So those are some things to watch out for. So the best spot to be is behind the patient when you're using a BVM. So you've assessed the patient's breathing, they're not breathing adequately. That's less than 8 times a minute, greater than 28 times a minute. We'd want to use this BVM. They're not getting good chest rise and fall, so we're going to use a BVM. We get behind them, position the mask, EC clamp, squeeze just enough to get chest rise. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1 1000. So you're breathing about every 6 to 8 seconds. That's 10 to 12 times a minute. Don't overventilate your patient. Sorry, I don't have a pediatric mannequin to use for you guys. So for the adult, we're going to bag the patient using the BVM 10 to 12 times a minute. For an infant or for a child, someone who's not an adult, who does not show signs of puberty, things like that, we're going to squeeze the bag about 12 to 20 times a minute. So a little bit faster there for you. One of the things I wanted to stress was the fact that if you're doing this correctly, absolutely keep going. But you've got to focus on what you're doing, because if you're not paying attention, you're going to start squeezing and air is going to come out around the mask and you're not going to be getting chest rise. So you're completely wasting your time. If you're not getting chest rise, then you are absolutely doing the patient no good. So I hope this video helps. You never know when you'll be the first responder, you need the right gear and the right training. So when we connect our BVM to the oxygen reservoir, now for me, if I'm in the ambulance, I'm in the ambulance truck, ambulance truck.